This animation will describe and illustrate the anatomical reasons as to how the JawDropper will ultimately relax the jaw muscles, keeping a patient's mouth open wider, longer, and more comfortably during a dental procedure. Here are the major muscles responsible for closing the jaw: the masseter muscle, the temporalis muscle, and the medial pterygoid muscle. Here are the smaller and more delicate muscles responsible for opening the jaw: the lateral pterygoid muscle and the digastric muscle. Together, these muscles are known as the muscles of mastication. Here is the jaw at 90% occlusion. This is the normal and most comfortable resting position for the average human. The average maximum jaw opening is 50 millimeters and is demonstrated here. With the jaw opened at 50 millimeters, here are the opening jaw muscles: the lateral pterygoid muscle and the digastric muscle. With the jaw opened at 50 millimeters, here are the closing jaw muscles: the masseter muscle, the temporalis muscle, and the medial pterygoid muscle. We will now demonstrate what typically happens to the jaw muscles over time during a dental procedure. After 10 minutes during a dental procedure, the jaw muscles become fatigued and strained. As the mouth now starts to fatigue and close, the dental professional will ask the patient to rest and close the mouth to then open again. The mouth will now only open back up approximately 45 millimeters versus the starting position of 50 millimeters. Over time, the jaw muscles are becoming more and more fatigued and strained. After 20 minutes, the mouth will only open back up to approximately 35 millimeters. After 30 minutes, the mouth will only open up to approximately 30 millimeters. Each closing of the mouth is causing the dental professional to not only have less access to the mouth, but also having to ask the patient to close their mouth more frequently, ultimately interrupting valuable and expensive procedure time. Introducing the JawDropper, a device that will assist in allowing the mouth to open wider, longer, and more comfortably by relaxing the mastication muscles. The patient will comfortably place the JawDropper on the lower incisors. Holding the JawDropper, the patient will exert slight downward traction on the handle end, pulling downward to relax the mastication muscles. The opening muscles are now being stretched and relaxed, ultimately relieving the jaw muscles of fatigue while extending the mouth opening for longer periods of time. As the lateral pterygoid muscle and the digastric muscles are being stretched with the JawDropper device, the masseter, temporalis, and medial pterygoid muscles are not competing to close, and in turn are also being stretched, creating less opposition to the opening muscles. We will now demonstrate how the JawDropper device actually maintains a wider and longer opening during a dental procedure. Here the patient is using the JawDropper with a beginning opening of 50 millimeters. After 10 minutes have passed, notice that the jaw opening has been extended to approximately 60 millimeters. As the mastication muscles relax, the dental professional does not need to remind the patient to close and open. After 20 minutes, the jaw is maintaining a comfortable opening at approximately 65 millimeters. For comparison, illustrated on the left is the mouth opening without the JawDropper, and illustrated on the right is the mouth opening with the JawDropper. After 40 minutes, the unassisted jaw has closed to 25 millimeters, while the assisted jaw that used the JawDropper is comfortably holding an opening at approximately 65 millimeters. In summary, there are many advantages to using the JawDropper. The JawDropper will allow the patient to keep their mouth open wider and for longer periods of time, provide the practitioner greater access to the mouth, allowing procedures to be performed in a more efficient, cost-effective manner, all the while providing a more comfortable patient experience.